Which electrolyte imbalance is most likely to cause U waves on an ECG? Correct answer is option B, hypokalemia. The hallmark sign of compartment syndrome is. Correct answer is option C, pain on passive stretch. What is the immediate treatment for a patient experiencing ventricular fibrillation? Correct answer is option B, defibrillation. Which condition shows a butterfly rash on the face? Correct answer is option B, lupus erythematosus. The most reliable indicator of fluid loss in a burn patient is. Correct answer is option C, urine output. Which is the first priority nursing intervention for a patient with chest trauma and tracheal deviation? Correct answer is option D, notify physician immediately. In hypovolemic shock, the primary problem is. Correct answer is option B, decreased cardiac output. Which condition is indicated by a positive bruising sign? Correct answer is option B, meningitis. What is the best position for a patient after a liver biopsy? Correct answer is option B, right side laying. Which type of hepatitis is most commonly transmitted through blood transfusion? Correct answer is option C, hepatitis C. Which drug requires regular monitoring of INR? Correct answer is option B, warfarin. Digoxin toxicity is increased in the presence of. Correct answer is option B, hypokalemia. Which insulin has the fastest onset of action? Correct answer is option C, lisproinsulin. Which antibiotic is contraindicated in children due to risk of tooth discoloration? Correct answer is option C, tetracycline. Which medication is used to reverse the effects of opioid overdose? Correct answer is option A, naloxone. Which class of drugs is contraindicated in asthmatic patients? Correct answer is option A, beta blockers. Lithium toxicity is enhanced with concurrent use of. Correct answer is option B, NSAIDs. Which is an antidote for organophosphate poisoning? Correct answer is option B, atropine. Which vitamin is necessary to prevent neural tube defects during pregnancy? Correct answer is option C, folic acid. What is the mechanism of action of omeprazole? Correct answer is option C, proton pump inhibitor. What is the most common cause of death in children with measles? Correct answer is option A, pneumonia. Koplik spots are seen in which disease? Correct answer is option B, measles. What is the primary cause of neonatal jaundice within 24 hours of birth? Correct answer is option B, hemolytic disease of the newborn. The first sign of puberty in girls is. Correct answer is option A, breast development. Which congenital heart defect is associated with a boat-shaped heart on X-ray? Correct answer is option C, tetralogy of Fallot. A child with crop will most likely have. Correct answer is option A, barking cough. The drug used to close a PDA in premature infants is. Correct answer is option C. Which vaccine is contraindicated in pregnancy? Correct answer is option C, MMR, measles, mumps, rubella. Which sign indicates dehydration in infants? Correct answer is option C, sunken eyes and fontanelle. What is the most common cause of acute glomerulonephritis in children? Correct answer is option B, group A, streptococcal infection. Which of the following is a negative symptom of schizophrenia? Correct answer is option C, apathy. Which drug is used as a mood stabilizer in bipolar disorder? Correct answer is option B, lithium. What is the most common side effect of electroconvulsive therapy? Correct answer is option B, memory loss. Phobia is best described as. Correct answer is option C, irrational fear of specific objects or situations. Which neurotransmitter is primarily involved in depression? Correct answer is option C, serotonin. Extrapyramidal symptoms are commonly associated with. Correct answer is option B, antipsychotic. Which is a therapeutic level for lithium in bipolar treatment? Correct answer is option B. What is the priority nursing action in a suicidal patient? Correct answer is option C, continuous observation. Delusions of grandeur are best described as. Correct answer is option B, belief in one's exaggerated importance. Which therapy is best for treating phobias? Correct answer is option B, CBT, cognitive behavioral therapy. What is the most common site of ectopic pregnancy? Correct answer is option C, fallopian tube. What is the best position for a woman in labor with a prolapsed cord? Correct answer is option C, Trendelenburg. The hormone responsible for maintaining pregnancy is. Correct answer is option B, progesterone. Which is the most common cause of postpartum hemorrhage? Correct answer is option B, uterine atony. When does the fetal heart begin to beat? Correct answer is option C, 5 weeks. The normal fetal heart rate is. Correct answer is option C, 120 to 160. Which is a presumptive sign of pregnancy? Correct answer is option B, amenorrhea. The partograph is used to monitor. Correct answer is option C, progress of labor. Which vitamin prevents neural tube defects in the fetus? Correct answer is option D, folic acid. What is the Apgar score used for? Correct answer is option B, assess newborn resuscitation need.